How you doing?
Pretty good, man. I don't want to keep you too long. I know you probably had a long afternoon here.
No, no, don't worry. David was just telling me that you needed to speak to me.
Yeah, just briefly. I know that I wasn't there, and I just wanted to. I know we did the article on the blog in late May 27th. Seems like a long time ago. It actually 3.5 months
Yeah, it
ago.
does, right? It does.
Your
It does
great
seem forever ago.
I know your great Zoom presentation, back pain prevention, causes, and treatment, and we talked about how people staying at home longer and all these problems, bad
Right.
posture, not getting maybe core strength exercises and all that. And I wonder
Exactly.
if you've seen what you've seen in the last 3 months since that presentation that is of interest, that would be of interest to the public in
No,
general.
well, we were just saying, like, our numbers have been increasing. I think it's maybe a combination of, hey, the state was shut down and now we're up and kind of moving more. And I think also patients have been kind of sitting and waiting, hoping that the virus would kind of calm down. But at this point, a lot of patients are been waiting for so long and doing more work at home and more exacerbations of pain. We just seen an increase of number of patients that we're seeing, and at points for certain patients, increase in severity.
So they're basically been putting it off because there was this surge we had in July, I guess, or in
Right.
June. So now they're coming in, and what's the biggest complaint you see, or what's the biggest trend you see? You think?
Yeah, I mean, a lot of the times is more of radiculopathy or nerve pain shooting down the legs or neck pain going down the arms, and I think a lot of it has to do with the posture, especially with now a few more months under their belt of working on a computer at home without their the special desk or the seating or stand up computers.
Right. And I assume that mostly is non-surgical required, or mainly treatment of moving more and maybe exercising and getting a better posture, that kind of thing.
There's a lot of combination. I think it's probably around 50-50. I mean, I don't know the numbers in front of me, but I would say some of them are coming in severe with weakness, hobbled over, can't walk, and that's where we're starting to talk about surgery and injections and more aggressive treatment, whereas other patients are coming in with mild symptoms, and we're able to manage that with medications as well as therapy.
So it's maybe an even split, or 50 to 60%.
Yeah, I would say. I think that's what I'm seeing in my clinic.
And are you seeing more of an older, or the age range is pretty wide?
It's the young and the old, a little bit of both. I mean, I had a patient the other day that's like mid-30s and had a herniated disc that needed surgery the next, sent to neurosurgery the next day. And we're lucky because we have a great relationship with neurosurgery, so I was able to get him into their clinic that afternoon, and then he ended up going to surgery the next day.
Wow, great.
And he's in his mid-30s, so we're seeing everything.
And yeah, no, I assume so, and I assume it hits older folks maybe a little more, or folks who've had issues with arthritis maybe, or
Right, yeah, I think the patients that already have pathology or older patients, they're more prone to having more pathology, so I think that those older patients are also having severe pain, and a lot of them, like one of them, poor patient, she was in severe pain. She fell, I think, 6 weeks ago or so, and she's been hobbling, limping, and she's older but active. She was on a boat and she fell, and then she was.
Right.
I felt so bad for her yesterday, and obviously she's independent, but now she's walking with a walker. She's limping. She's
Right.
taking smaller steps, and she's been trying to deal with the pain. But I had to send her for more detailed imaging to see where the problem was exactly.
She didn't put off. Did she put off treatment, or did she come in fairly soon after?
He was kind of downplaying it. I think one, she didn't want to be a burden to her family, I think,
Right.
and the other thing was, I think, because of everything going on with the virus, she's just kind of holding off and hoping that it would get better, but it wasn't, and her family, her daughter finally convinced her to come in. So,
Okay.
Poor lady, when I saw her, she was weak and was barely walking and needed help to walk. So I felt so bad for her, but we need further imaging to see, hey, is it something in the neck, in the low back versus something in her hip, and she's pending that imaging now.
Okay, so I mean, what I'll do is I'll put a sort of a new top on this article and republish, saying basically a lot of people are coming in because they've been improperly, putting off treatment when they shouldn't, because there's no
Right.
need to be afraid or anything. you know, of all age range is wide, and you know, don't delay, as we're telling everybody, don't delay.
At least be evaluated. I mean, a lot of patients are also afraid, even with treatment, they were saying therapy, but a lot of patients are afraid to go to physical therapy, which we understand. I mean, but I think it's worth it for them to be at least be evaluated to make sure, hey, is it just a muscle issue? Is it something that can get better? Is it something that, hey, needs a little bit more urgent imaging and treatment?
And they're, you know, physical therapists take precautions as well, and you know,
Yeah, of course.
they shouldn't be afraid of that at all. Okay, anything else?
Right, but I think coming to an office visit once every month or every 3 months is a little, you know, like it's less scary than going to therapy 2 times a week or.
Oh no, yeah, I can see that.
So
Yeah.
I think that's where the difference is. But I mean, nonetheless, some people say, hey, it's okay, I feel fine, and they go and they do better. And some people are like, listen, no, I don't feel safe doing that. We can give them exercise at least to kind of hold off until hopefully this virus gets better and the circumstances get better.
Show them exercises, or show them, give them instruction on exercise or advice on what to do. And that
right, exactly, and things to look out for. Right, you want to make sure, hey, we're not causing permanent damage. So that's where you know, just advice on what to look out for.
Okay, Doctor, did I miss anything? Anything else you covered in the interview with NBC? Everything? I think this is pretty much.
I think that's it. I mean, we have a patient that was here and interviewed with us as well, and she just kind of talked about what she was going through, being working at home, and she had back pain as well as neck pain, and we were able to treat both, and she's much more active now and able to do activities, and very happy with her care.
So it's just kind of a typical case where it wasn't nothing serious that requires surgery, but
she needed a few injections, but we managed with injections and medications and home exercise.
And what was her rate?
I think if you want to mention too, I think that the number of increased cases between I think March until around now, we're doing 32%.
Increase?
Back pain related cases.
Okay, it's in the last, what time period are we talking? The last 3 months or?
No, about the last, I have it here. I want to say, give me 1 second, I have it here.
Oh, great, I appreciate it.
Yeah, I think they had mentioned from March, so we're probably talking about 5 months, I guess?
Yeah, since the...
About 5 months.
Yeah, since the, the lockdowns sort of began late March, yeah. So, I guess we're talking 6 months, right? Yeah.
Yep, I'm looking right now at what I spent. March to August.
Okay, perfect.
Yeah.
So about 30% March through August. It's great.
Yep.
That's great information. Thank you, Doctor, again, for all your great work and
No problem.
for
Thank
taking
you.
this.
And John, I think the plan is Alesco's going to do something with social to coincide with the blog post. So if you don't mind just letting me know when it'll publish, so I can let her know too.
Okay, and when is the NBC program airing, or the segment?
I don't think they know yet. If they're going to put all the elements together, I'm going to ask them right now.
Okay, all right. Thank you, Doctor and David. Appreciate it, guys.
Thank you.
Take care.
Have a good day.
You too. Take care.
Appreciate you.
Bye-bye.